Getting back to you, Dr. Gray, we know you oversee Lincoln All Heart Institute, which serves a very diverse group of patients, and you also see the end result of health inequities, which is too often, heart disease and poor quality of life and shortened life expectancy. And on top of that, these same patients are faced with more adverse outcomes from coronavirus. Can you speak to anything additional that you're seeing as a key driver of health inequities that we haven't maybe touched on so far?
Thanks, Dwayne. Yeah, we do serve a very diverse community. We have Mainline, which is a pretty well-heeled community to our west, and West Philadelphia to our east. And so we see the differences in access to healthcare, health education, literacy, access to healthy food choices. One of the things that happens because of issues around health literacy is that, and access to health care, frankly, is that we see a lot of patients coming to the emergency room as their primary source of medical care. And that's obviously not what we want to see, because that means that they're at the end of a long disease process that probably could have been interrupted in a meaningful way before they came to our emergency room. And we've just kind of to touch on that for a moment, we've worked at Mainline Health and with the Lincoln Heart Institute, along with the AHA, to build community clinical linkages. That is, reach out into the community to trusted sources there to really address issues around health access, education, and literacy. That's an important community effort because it really addresses the core issues that we see in our emergency rooms regularly. And I want to boil that down for our audience to a very concrete example, which is hypertension. We all know that treating hypertension can reduce stroke, heart attack, kidney failure, and heart failure. And we treat hypertension aggressively. And even in the best of circumstances, people don't comply with their blood pressure medications or don't get controlled probably about 50 or 60% of the time. So that's in the best ideal circumstances. Imagine going to an underserved community where they don't have access to clinical care, they don't have healthy food choices, they can't get medication, they don't get educated on the importance of hypertension. So what happens is they show up in the emergency room with any one of those problems. They come in with hypertension related kidney failure, and they're then dedicated to renal, dialysis for the rest of their lives. Something that could have clearly been avoided had they been able to address the hypertension earlier in their lives in a more aggressive way. These are real people we see on a daily basis that we need help with in terms of getting them the access to medical care, the literacy for medical care, and better access to food choices. The AHA also works alongside primary care providers within health systems like ours in the Mainline Health and federally qualified health centers to improve standards of care and to expand patient education and address these barriers that are caused by the social determinants of health. And the example I just gave you is a very, very meaningful one. The AHA has also prioritized evidence-based concept of patients self-monitoring blood pressure from home and to assist with the accurate diagnosis and management of hypertension. And this will go a long way because the ripple effect of just something as simple and straightforward as hypertension control is not just for the patient, but for their family and for their community is very, very meaningful. In addition to the work in the community that we do and in clinical settings, the AHA also advocates for longer-term solutions like expanding health plan coverage for blood pressure cuffs, and works further upstream by collaborating with city governments and large employers in food industry to limit sodium content in foods. And the sugary drinks is a good example of where we've been able to do that on the obesity and diabetes side of the equation. So we've already made we've had some wins. There are many more. It's a fertile ground for improvement. And I think this call and things and activities like this are critically important to moving this forward.
Yeah, thank you for that. Yeah, there's no shortage of opportunities for sure. So thank you.